family health development. She has contributed extensively to research and publications, making her a respected voice in advancing healthcare for Malaysia's aging population. Please welcome Yang Berbahagia Datuk Dr. Hajah Norsia to share her keynote address on healthy aging for all, transforming primary care delivery for Malaysia's older adults. Please welcome.
Thank you, Madam Chairperson. Yang Berbahagia Profesor Datuk TS Dr. Sharifuddin Mat Syahrani, Vice Chancellor of USIM. Yang Berbahagia Profesor Datuk Dr. Muhammad Taufik Muhammad Noor, Deputy Vice Chancellor for Research and Innovation of USIM. Yang Berusaha Dr. Selva Ganapati Anak Lelaki Ganesan, the Chairman of Malaysian Medical Association for Negeri Sembilan. Yang Berusaha Dr. Muhammad Fakri Abu Zak Baharin, Director of NHS 2025 and his fellow committee members. Yang Berusaha Associate Professor Dr. Razlin Rahim, Dean of the Faculty of Medicine and Health Sciences of USIM. The Deputy Deans of the Faculty, distinguished speakers and all participants of this seminar. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi. Salam Malaysia Madani. First of all, I would like to thank the organizing committee for inviting me to come to this seminar. I really feel honored with the invitation, and I would like to deliver a talk entitled Healthy Aging for All, Transforming Primary Care Delivery for Malaysia's Older Adults. In fact, just now, Prof. Datuk TS Dr. Sharifuddin mentioned about Singapore, and how Singapore prepared the citizens for aging country, and in fact now Singapore is already reached the super age country state. I went to Singapore last week for a visit with Health Transformation Office team to look at how Singapore now handling the older people, doing digitalization and transforming primary care. And there are a lot of things learned from that trip. So ladies and gentlemen, in my next so-called 45 minutes, I will be talking on these topics. So Malaysia has reached a status of aging nation. This is referring to our data last year, and whereby we have reached 11.6% out of 34 million population age 60 and above. So we are menuju ke negara tua, aging country, and it is expected by 2035, we'll reach age nation, whereby 15.3% out of total population will belongs to those age 60 and above. Some countries worldwide use 65 as definition for elderly people. We are still stick to 60 and above. And we anticipate by 2050 we'll be reaching super age nation, whereby 22% out of total population age 60 and above. As I mentioned, the definition of older people that Malaysia use, 60 and above, and we say that the nation is aging nation when the percentage of elderly population reach 10% of the national population. And And aged nation is when the percentage of elderly population reach 15% of the national population. Yeah, and so we've got to prepare ourselves to age nation. Yeah, whereby I think in Malaysia we've got quite a number of geriatricians already and quite a number of FMSs with subspecialization in geriatrics. And Dr. Razia, the head for geriatric subspecialty, is in this auditorium. Yeah, we've got, I think, quite a number of FMS also had diploma in geriatrics, and we are producing more and more experts in this area in order to equip our country to the needs of aged population. Yeah, so the impacts of growing elderly population on healthcare system is not a little. It may give a huge impact. Yeah, where there will be increasing prevalence of chronic diseases and geriatric related diseases, increased utilization of health services, overburdened healthcare facilities, increased healthcare costs and long-term care demands, and poorer health outcomes and reduced quality of life for older persons. Yeah, so that's why we really hope many will belongs to the healthy age group. Yeah, in Singapore they divide the elderly into three. Yeah, old people. Yeah, elderly with some form of comorbidity, but they are still not too bad. Yeah, and the debilitated ones. Yeah. All right. So, looking at the spectrum of our neighboring countries, yeah, where we are, yeah. So you can see, according to last year's data, Malaysia has about 11.6% aged people. Thailand, yeah, Thailand has reached 22%. Yeah. And Singapore last year almost close to Thailand. Yeah, but I think countries like Laos, Philippines, they are still rather young, yeah, younger than us, right? Okay, let's look at the aging trends in our country. Yeah, if you study this slide, yeah, more and more older people lives in Malaysia. Our life expectancy is also increased from years to years. Yeah, could be because of better health care, and if you look at the distribution of states, yeah, negara yang paling tua is Perak. Yeah, Perak dah almost 50%. Yeah, last year. Yeah, almost 50% of the Perak population. Yeah, aged people. Yeah, followed by Sarawak, Kedah. Yeah, so these three states, Perak, Sarawak, and Kedah. Yeah, whereas in total Malaysia as such, so Selangor, Johor, Kelantan around the national prevalence. Yeah, and rather young. Yeah, wilayah Persekutuan Putrajaya. Yeah, because most working people are there. Yeah, very small number had their retirement age in Putrajaya. They decided to go back to their hometown, you know. So the youngest state is Putrajaya and the oldest state is Perak. Alright? And let's take a look at the health status of older person in Malaysia. Yeah. So we've got our National Health Mobility Survey finding for diabetes now is around 17%. Yeah, a little bit better compared to those days where it was 1 in 5, now is 1 in 6. Yeah, but for the older person, diabetes contributes 27.7%. Yeah, close to 30%. Yeah, almost 1 in 3 older age group in Malaysia has diabetes. All right, and hypertension. Yeah, national population in general, yeah, it's 1 in 3, yeah, about 30%. But for the Malaysian 60 and above, half of them has hypertension, 51.1%. Yeah, and hyperlipidemia contributes 41.8% of the NCD burden among the old people. All right, so let's look at the quality of life. Yeah, 4.7% noted to have poor quality of life. Yeah, when we talk about quality of life, we talk about the health determinant, the economic determinant, the social determinant, and the psychological determinant. Yeah, and 34.34%, yeah, had poor OHR quality of life. Yeah, 24.6% low social support. This is quite worrying. Yeah, and 9% reported to have experienced abuse, some form of abuse. Yeah? Let's look at the nutritional status of the old people. Yeah, a third of them has malnutrition. Okay, malnutrition meaning it could be so thin or obese. Yeah, and 10.4% noted to have food insecurity. Yeah, and the functional status, yeah, you can see that they are also affected. Yeah, whereby independent activity of daily living, 41.9%, and those dependent about 17% to some extent. Yeah, and geriatric syndrome. Yeah, let's look at the geriatric syndrome. 8.5% has probable dementia. Yeah, 11.2% has depressive symptoms. 2.9% noted to have stress. Yeah, 3.4% urge incontinence. 15% had severe risk of falls. Yeah. So it is very important for us to be aware of our current situation and plan and strategize and start action, yeah, to minimize all these burden. Yeah. So this is the National Health Policy on older person. Yeah. Actually, the old person in our country is generally taken care by 2 ministries. Yeah, one is Ministry of Health, taking specifically on the health of the old people. Yeah, because as you grow older, being unwell is so common. Yeah, and another ministry is Kementerian Pembangunan Wanita, Keluarga dan Masyarakat. Yeah, specifically Jabatan Kebajikan Masyarakat. Yeah, so these 2 ministries take care of the old people. MOH take care of the health status, where KPW, PKM take care of the social aspect of the old people. Yeah. So this is the National Health Policy. This is prepared by KKM. Yeah, and we've got all this document, Elderly Health Services Action Plan. Way back in 1997, KKM has produced this. Yeah, BPKK specifically aware about the needs of old people. Yeah, and in 2008, KKM produced Elderly Health Services Action Plan. Yeah, and we've got Elderly Health Services Action Plan 2023 to 2030. Yeah, actually our country has the aging blueprint already, yeah, document that is prepared by various ministries, related ministries. It's still in the embargo state, yeah, not yet released, but that just reflect huge effort is now done to make our country prepare for each nation. When I first graduated as FMS in 1999, yeah, it was about almost 27 years ago, yeah, my FMS journey. I was posted to KK Tampin, yeah. So at that time in 1999, KK Tampin already has this special building for expanded scope for the elderly care. Yeah, this is in line with the Elderly Health Services Action Plan that BPKK produced in 1997. Yeah, at the same time, there was also this building for children with special need. Yeah, so it's under expanded scope wing of BPKK. Yeah, and I remember in 1999 onwards, yeah, we've got this building where our one of the staff nurse were assigned to take care of the old people coming to our clinic, get it registered, and make sure they come to the building to be members of the elderly club. Yeah, elderly club, unregistered at that time. Yeah, elderly club. So screening was done. Basically, screening for nutritional status, screening for cardiovascular diseases, screening for mental health issues, specifically looking for depression, and screening for cognitive function. Yeah, I still remember because I was the first FMS there. Yeah, and we actively screen and receive referral from our team who take care of the services for further intervention. Yeah, and in that building they have this pantry where they can cook. They have this living area. They have cushion, dining set, and a corner. Yeah, I think half of that building was equipped with physio rehab devices. Yeah, something like handrail, something like for shoulder rehabilitation, bicycle, static bicycle. Yeah, and the old people, the kids send them around 8 o'clock, 7:30, and they leave at around 5. Yeah, it's like a daycare center. Yeah, and they had this social gathering, birthday celebration. Pawe came in the picture way back in 2015, 2014 in Tampin. So long. So it was 1996 that building was, no, I think 1998 that building was developed, was built. Pawe under Jabatan Kebajikan Masyarakat, yeah, came in Tampin in 2014 before I left to Masjid Tanah. Yeah, so I think BPKK KKM has this idea of expanded scope of focusing on elderlies so long already. Yeah, just that I think one of the challenges that we face is to expand and sustain such services, because I think our medical staff also need to focus on the activities in the clinic itself. Yeah, and if I now relate with my experience last week in Singapore, yeah, so actually Singapore, they divide them into 3. They've got this a special organization non-medical that is taking care of their elderlies. Yeah, they said it's too expensive to get a nurse or something like our PPP, our MA, to take care of these people because they are more needed for direct patient care. Yeah, so Singapore utilize trained personnel, yeah, non-medical personnel to take care of the elderly services, yeah, be it for promotion of active aging, for the well age group, some with some disability and the debilitated ones. In Singapore, I think all of you are aware that Singapore is small. They have all these apartments. Yeah, they put walls at the ground floor, where initially the apartments were built with pillars on the ground. Yeah, and the pillars were not walled. Yeah, so they walked the apartments, the ground floor, and made it as center for the elderlies. So the residential areas, quite a big complex, they identify who are the old people. So they classify into 3, and they provide the 3 services there. So they can go join the active aging team, or they can join some with some impairment. Yeah. So bila I join yang active aging tu, I tengok diorang main game. Ya, dia main game, game yang gerakkan bola and something like bola keranjang. Ya, dia ada goal net dia, tapi guna pakai game. So dia tak boleh loncat-loncat lagi kan. Nanti kan osteoporotic nanti patah pula kan. So they had fun, you know, and they had many other activities. I think same like our Pawe, yeah, same like our Club Warga Emas, yeah. Yang ada some disability tu, I tengok they group them, and dia ada yang buat drawing, yeah, colouring, macam kinders lah. Really, I tengok macam kinders, ya. Ada pegang soft toys yang demented, yang mungkin ada anger, aggression kan. They just want to calm the emotion, ya. Dia pegang doll. Super age state, super age country, dah macam tu. Maybe we are going towards that, but not MOH alone lah, kita mungkin tak boleh samakan sepenuhnya dengan Singapore, but we do using our own template, so we have KKM, we have Kementerian Pembangunan Wanita, Keluarga dan Masyarakat, we collaborate together, so let's look at the health services for older person in Malaysia. As I mentioned some of it just now. So before 1996, there were no specific healthcare services. Older person receive curative or treatment as outpatient or inpatient according to the ailment. But from 1996, beginning in 1996, there were establishment of older person healthcare service through expanded scope of healthcare services like what I shared just now. Establishment of geriatric service in hospital. In 1997, the first elderly health services action plan was developed and started registration of older person attending health services, and elderly health club in health clinic was expanded. I remember in my initial years, many clinics tried to have this Club Warga Emas. At one corner they identify vacant building or some store, they vacate the store and turn it into a place for older persons activities. In 2007, the first geriatric ward in HKL. In 2008, National Health Policy for older person were developed. In 2009, we've got comprehensive older person health screenings, yeah, where we've got this FPSK, borang saringan status kesihatan for various age group, yeah. So for you all know, BPKK, we take care of the function of the nation from womb to tomb, yeah. From pregnant mom to neonates to toddler, children, teenagers, adults, and elderlies, yeah. So we take care of the function, yeah, function of our nation. PSSK also screen for the teenagers, adults, women, adults, men, yeah, and the elderly, yeah. In 2014, KKM started with domiciliary treatment care services, yeah, where old people and domiciliary care is quite very closely related, yeah, where according to our census, about 2/3 of domiciliary care services in our country run by KKM were for the old people, yeah, a third for the remaining, okay. In 2018, there were this introduction of elderly healthcare in community clinic, and in 2023, we've got this older person healthcare service action plan, and we were asked by WHO to also produce dementia action plan, yeah. So KKM took the initiative and produced this document of dementia action plan 2023 to 2030, yeah. So that inclusive of early screening, yeah, and early intervention, so that the person won't progress so badly into dementia that require a lot of care and support. Okay, this is just to share with you the health services provider in the public sector and the private sector that we have in our country. So we've got Ministry of Health, Ministry of Higher Education, Ministry of Defence, Environmental Health Division of the local authorities, yeah, that are all contributing to care for the older person, yeah. Specifically, the Environmental Health Division of the local authorities will provide license of care centres on environmental health, yeah. Whereas for the private sector, we've got the clinic or private hospital, NGOs and private healthcare, and other private facilities as listed. And we've got I think booming of private nursing home now, yeah. So this is just to share with you on the MOH facilities, where we've got about 45,900 official hospital beds throughout the country, yeah. And health clinics, we've got 3,114 health clinic and its subsidiaries that BPKK is taking care of, yeah. We are taking care of 1,103 now health clinic, yeah, of various types, yeah, type 1 to type 7. Rural clinics 1,716, maternal and child health care about 80, and community clinic 223, yeah. We also have mobile clinic and inclusive of flying doctor service team, mobile clinic, be it bus or boat, yeah. We also have community dental clinic, various dental clinic and mobile dental teams. So this is to share with you on the elderly health services by the Ministry of Health. So in primary care settings, it is being provided by all health clinics, care for the old people, yeah, to some extent. But we've got elderly clubs, yeah, elderly clubs, about 256 clubs, yeah. So this year, KKM encourage, yeah, the clubs to be registered with ROS. It's not compulsory, it's encouraged, yeah. And in tertiary care, we've got rehabilitation hospital with geriatric specialists, about 21 of them, and hospital with visiting geriatric specialists, 23, yeah. And in community setting, we've got outreach health services for elderly health screenings and risk interventions in the community. We have got domiciliary treatment care services, 545 teams, palliative care, 380 teams, home nursing care, and visits to elderly care institutions or centres like Rumah Sri Kenangan and something similar. We do visit those institutions. And these are KKM's human resource. As you can look at the slides, that currently our doctor to population ratio is 1 to around 400, yeah. But we've got about 80 geriatricians, yeah, geriatrics psychiatrists, 12 of them, family medicine specialists trained in geriatrics, all together about 22, yeah. Be it in subspecialization or diploma, we've got 22 of them. So we've got quite a number of experts in geriatrics, yeah. And we also have a registered nurse trained in geriatric care, 34 of them, community nurse trained in geriatric care, quite a number of them, about 500, and assistant medical officer trained in geriatric care, yeah, about similar with the number of nurses with similar training. And I think it's very important to share with you the challenges, yeah, that we face, especially in health services for the older people in our country, yeah. Malaysia is becoming age nation in unprecedented speed, yeah. Now is 2025, yeah. I think it is soon will be an age nation, yeah. Extended longevity with compromised well-being, with multi-comorbidity, yeah. 3 serangkai is quite common in the elderly, yeah. Increasing non-communicable diseases among adults, and health only contribute to 20% of older person well-being, yeah. So to perceive yourself, to feel well, yeah, it's not just health, yeah. Emotion, social, financial, money. Ada money boleh pergi jalan-jalan, boleh pergi holiday sana sini, kan. Tak ada money, tak boleh pergi mana-mana, mood pun jadi down, yeah. So there are many other contributing factors, yeah, to well-being of all person, yeah. So just take a look at these slides on this increasing, yeah, life expectancy in our country, yeah. All right. So KKM face a lot of challenges, yeah, and despite all those challenges, we hope that we can transform primary care delivery to Malaysia's older persons better, yeah. So now what is happening, there is a shift to preventive and person-centered care, yeah. So now the focus is sihat itu saya, yeah. The focus is to make yourself healthy, okay, prevent from getting sick, ya, prevent from getting diseases, ya. Kita tak boleh prevent menjadi tua, ya. Everybody will be age, ya. Everybody will be old, and then young, old, and then old, and then old, ya. 60 to 70 adalah young old, 70 to 80 adalah old, 80 and above adalah old. Jadi everybody kita every year kita celebrate birthday, kan? So kita kena aware we are growing older and older, kan? Tapi very important untuk kita prevent, modify lifestyle, ya, so that hopefully kita boleh prevent from getting all these preventable diseases, ya. Another form of transformation is life course approach to healthy aging, ya. Integrated continuum of care, enhance community engagement and prevention, and leverage digital health and telemedicine in care for the elderly, ya. Kalau developed country, our neighbor like Singapore, ya, so diorang memang community engagement and prevention ni memang bagus. The old people walk, ya. I think many Singaporean memang kiasu. Dia punya prevalent diabetes 1 in 10. Malaysia 1 in 6 now, better. Dulu 1 in 5. Mereka kan sebelah tambak Johor je, 1 in 10. Yeah, and I tengok dia all memang walking. I know someone from Singapore, dia spend about 3-4 jam sehari walking at retirement age. So kerja dia jalan je, keep walking, because dia nak build up dia punya muscle, yeah, so to prevent sarcopenia. Okay, alright, and mereka memang literate, ramai yang literate on apps, yeah, to access for certain care. They use apps, yeah. So the whole premises in Singapore semua digitalized, yeah. So we hope we will be there one day. We are in the process, yeah. So this is the older person health from life course perspective, yeah. So kita kena prepare, yeah, daripada primordial lagi. Katalah pre-pregnancy, ensure kalau you diabetes, ensure you are well before you get pregnant, yeah. Supaya in vitro anak tu less likely dia having the risk of getting diabetes later, yeah. So dari primordial age until age in vitro sampai adult, kita nak promote on promotive, preventive, early detection and prompt treatment, and then on intervention, treatment and reduce complication, and when reach the older person state, delay functional decline and dependency. Okey, 5 minit insyaAllah habis. So MOH dulu kita guna BSSK, ya, booklet tu. Sekarang kita dah start guna Integrated Care for Older People screening tool that come with intervention, ya. ICOPE, this is from WHO, where dalam ICOPE kita ada screen intrinsic capacity, and then kita ada person-centered assessment, and then kita develop care plan, and then kita boleh link and monitor, and kita engage caregivers, ya. Kalau di Singapore, mereka sekarang dah guna Interride, ya, lagi extensive assessment untuk dia really boleh tahu needs tu dekat mana. But I think Malaysia now for a start, ICOPE ni dah bagus dah for a start, ya. Okay, later specifically kita boleh guna yang another more extensive screening tool, ya. So sekarang ni ICOPE kita dah mulakan pilot project in Perlis, ya. where we actually KKM punya planning, we identifying community clinics yang ada kurang workload antenatal care, ya, untuk kita juga lihat coverage population. Kalau ramai elderly, kita akan add function of that community clinic rather than focus on maternal and child health, but also do on elderly care in the afternoon. Yeah, so I've been to Klinik Desa Padang Melangit in Perlis, yeah, where we piloted this and we empower volunteers, yeah. Kita panggil local ambassadors lah, volunteers untuk kita latih mereka, and then mereka pergi rumah ke rumah buat screening and kenal pasti siapa lagi warga emas yang ada dalam kawasan coverage tersebut, ya. Dan daripada dapatan satu kawasan coverage Klinik Desa Padang Melangit, we identified a few issues lah, ya. Isu penglihatan, ya, isu ada isu mobility juga, ya, ada beberapa isu lah, dan di klinik tersebut mereka buat aktiviti sosial lah pada sebelah petang, ya. And so kita pun dah expand benda ni ke negeri Kedah, where in Kedah kita dah mula collab dengan Kementerian Pembangunan Wanita, Keluarga dan Masyarakat through Jabatan Kebajikan Masyarakat, collab dengan dia punya pawai, ya. So insyaAllah we'll be expanding this throughout the country, ya. So leveraging the digital health and telemedicine for elderly care, we want to enhance health access through digital platform, promote telemedicine for remote consultation, improve healthcare efficiency via digital solution, and utilize digital tool for chronic disease management. So kita punya My Sejahtera apps sekarang ni kita sedang tambah baik, dan kita harap kita akan boleh make old people easily accessible untuk healthcare, yeah. We want to ensure equity, and we want to ensure accessibility for all nations, termasuklah our old people. So Malaysia now stands at a crossroad. Within the next decade, the number of older adults will nearly double. To ensure that our parents, grandparents and future self age with dignity, we must transform primary care into a preventive, integrative and person-centered system. Tadi Prof Datuk VC Prof Dr. Taufik, ya, kata tak lama lagi nak age, kan. Saya pun sama, ya. Ramai juga kita akan sekapal nanti, jadi kita kena beri fokus untuk diri kita jugalah, so this transformation demands leadership, collaboration and investment from government, healthcare providers, academics, industry, communities and families. It also requires compassion and respect for the life experience of the older adults. So I invite all of you, yeah, to become champion in healthy aging. Congratulations USIM for conducting this seminar, yeah. Let us embrace innovation while upholding our cultural values, build systems that integrate medical and social care, and create age-friendly environment in every village, every town and city. So by working together, like Prof Datuk VC tadi cakap, we need to work together, jangan silo-silo. We can ensure healthy aging for all and make Malaysia a model for the region, yeah. So with that, thank you for your kind attention.
Thank you so much, Datuk Dr. Marusia, for the very insightful presentation and very eye-opening to me. Please kindly stay on stage as we proceed with our next agenda. And once again, I would like to invite our Vice Chancellor, Datuk Yang Berbahagia Profesor Datuk Technologist, Dr. Sharifuddin Mat Syarani, and Yang Berusaha Dr. Muhammad Fakhri to come on stage and deliver the token of appreciation to our keynote speaker. Dr. Hajar Norsia.
Now, I would like to invite Yang Berusaha Dr. Salva Ganapati to come on stage to receive a token of appreciation from our Datuk Vice Chancellor. Thank you all distinguished guests. You may take your seats and we would like to invite all participants for a group photo. Please kindly fill up the front seats to ensure visibility in the picture.